Hi everyone, this is Saumik from Real Yoga. Today I'm here to share something with you is about knee pains. Knee pain can be very sensitive, let me tell you, because majority of us when we go through a knee pain, we do not know what to do. And before I get into a knee pain exercise, that what you should do when you're knee pain, I would like to explain to you things that how the mechanism of our knees looks like. So this is we call knee pains. Often I see students, if they feel pains on the top of the knee and the patella, they call knee pains. If I say they feel below the knees over here, they also call knee pains. Some of you feel on the medial side, which is the inner side of the knee, you also call knee pain. And certain times you feel the lateral side, which is the outer side, you also call knee pains. But let me explain to you, all these four areas are causing different impacts on your knee. So today I'm going to tell you, before I go into the exercise, that's what is the mechanical of the knees. So most of the times, if you're feeling pain, when you're staring down, when you're walking down the stair, you most of the time feel the knee pain, which is below the patella, which is over in this point. This is the patellar ligament, which is due to the weakness on your knee. What is patellar ligaments? The muscles coming in become tendons on the top of the patella, and they go on the top of the patella, holding the patella and attach into your tibia. So because the weakness of the rectus femoris, these muscles, or we call patellar tendons, the weakness over here, they cause certain level of stress, especially if you're running, jumping, or taking stairs. So I will tell you shortly what you need to do. Next kind of your knee pain, which is most often yoga practitioner feel, or a practitioner, those who come to yoga mat newly, and you probably have done overstretch yourself, and you feel pains over around this medial side of the knee, which is the gracilis or sartorius. These two muscles, one of it gets tensions because of the shortness on the gracilis, which coming from your inner legs all the way coming into your medial part of the knee. So if you feel impingement over here, tensions over here, that's not about the knee pain. You just need to stretch to recover it. But do take notes, our knees are being positioned or hold by the two important ligaments, which is ACL and the anterior ligaments, and PCL, the posterior ligaments. But other two ligaments, which is holding the knee from the inner side and the outer side, the medial and the lateral side of the ligaments, as well important. So let's get into the exercise which will help our knee to recover from any kind of knee pain. So before I go in, let me tell you, I need you to have two blocks. One is in yoga blocks, and one, if you get a roller, that would be good. But at home, if you do not have a roller, roll a towel. That's what you do it. Make a towel, roll it. So first exercise I'll be asking you to do is keeping the legs straight, and you need to lock and contract your knees, contract your quadriceps, hold it for some times that you create certain level of strain on the rectus femoris, on the quadriceps muscles over here, that you get a support onto the patella and the patellar ligaments. So after contraction, you release and contract, hold for 1, 2, 3, 4, 5, and you release, again contract, 1, 2, 3, 4, 5, and you release, again contract, 1, 2, 3, 4, 5, and release. This way, you'll do about 10 rounds on your right and your left side. Then you're building the strain onto the muscles, which is running over to the top of the knees as a tendons and goes across the patella and attached to your tibia as ligaments. This weakness causes knee pain, especially for senior citizens. The next exercise, I need a block. So position your block, keeping your both legs on the top of the block. Sit tall and nice, keeping yourself straight. So what you need to do, make sure that you are sitting comfortable. If you feel not comfortable, keep your cushions under your glutes. So now over here, look at my feet. I want you to support your hands nicely, point the toes, and you flex the feet. So you point the toes and you flex the feet. When you're flexing, keeping the legs completely nice, long and straight. As you're pointing, extending it out. By doing this, you are stretching the tendons, the ligaments, the fascia on the back of the knee, the knee regions, all the muscles, so they can support your knees. So how many times you should do? About 10 times. Flexing and pointing, flexing and pointing, flexing and pointing. And once you're done, let's bend the legs and gently sit onto your buttocks, and we're going to go for nice butterfly pose, which we call Bandha Konasana. Next, we will go for lying on our chest, that we can increase the mobility on our knee. So I'll be requesting you to come onto the chest, that you get ready for increasing the mobility of the knee. Majority of the time, I have noticed those who has a knee pain is due to the immobility. So if you experiencing the knee pain, you'll realize that you're not able to bend the legs further. So you'll feel that your heels are not touching to the buttocks. So you feel that there is stiffness on the knee. The simplest way to release the stiffness is bring your hands onto the floor, look forward, and you hit the left and to the right, and to the left, and to the right, and to the left, and to the right. So this way, you continue about 25 times, left and right. What exactly happening when you're bending the legs? You are creating stretch onto those ligaments, holding the knee, because generally in our lifestyle, if you are not coming to yoga mat, we don't really require to bend the legs throughout. It doesn't matter how far it goes, as long as you're bending. That you do. Once you've done 25 times, you're releasing it and you're resting nicely and relaxing your head. And coming up, we will go for the next exercise, which is even more important. This is the exercise I call is for the IT bend, which is the lateral part of the knees. Is also related to when you get tighter onto your gluteal area, the gluteal maximus, the gluteal medius. They also create tension onto your fascia lata, and you feel some kind of pull onto your IT bend shorten. And if you feel a pain on the outer side of your knees, which is the lateral side of the knee. So what you need to do, just simply keep your hands on the floor. You elevate the knees up this way and bring the knees down. If you want to create a lot of tensions, so bring the knees up and down. But easier way, keeping the feet together, you bring it up, opens and bring it down. If you want to know what exactly happening into your body by doing this, I ask you to keeping your palm onto the glutes over here. When you bring the knees up, you probably feel the rotations happening. So what exactly happening? You creating a abductions onto your femurs. When you open it up, you're creating abduction or external rotations. By doing that, you're working onto the gluteal muscles, increasing the mobility of the gluteal muscles if they are the one creating tensions for your knees or the activity. How many times are you supposed to do? Just 20 to 30 times. Once you're done left, I advise you to come and go to the right side. It's best to do both sides, left and the right. So come on your elbows, keeping your hands onto your gluteal, that you are the witness of what exactly happening. When you bring the knees up and down, you probably feel a sensations onto your gluteal. The rotations happening, and that's where you are stabilizing and strengthening. So once you've done 10 times, I think I have done about 7 or 8 times. So I'll be showing you 10 times, but when you're practicing your own, do 20 to 30 times. And once you're done, you relax. So you can sit it up. And the last exercise, where I will show you, you can do onto your back. So when you're lying down onto your back, you will be, goes onto your back, and you bend your right knees, your hands back of your knee. This is I call space creations for your knee. So you'll be doing a gentle rotations on your knee clockwise about 10 times, and you will do anti-clockwise as well. I will show you one knee, but for you practicing, please do on your both knees. Especially those who goes running, a lot of walking. If you prefer to walk or run or cardio exercise, these are very good exercise to create space onto your knee. So once you're done clockwise, please go for anti-clockwise as well. If you feel there's a little bit of cracking sound coming from your knee, that's perfectly alright. Nothing to be worried with that. So I'm showing you right now one side. When you're practicing, please do both sides. As soon as you're done, roll and sit up. And before I aim that plus, this is where I want you to do with the foam is get a foam rollers if you have it. If you do not have it, that's fine. Get a towel, roll it high, and place them back off your knees. So this is the most important exercise. Though this looks pretty simple and easy, but this works a lot on the stabilizing the knee. So what are you doing? You position the back of your knee on the rolling foams or in a rolling towel. You just engaging your quadriceps femoris and engaging the legs, flexing the feet. Do not hold there, exhaling, releasing down. Inhaling, engaging, hold it, exhaling, releasing down. Inhaling, hold it, exhaling, releasing down. Inhalation, hold it, exhalation, release it. So does it left and the right movement? I personally enjoyed so much, especially the day I have to go and run. I feel next day my legs are pretty tight or the knee is stiff, or if I feel certain level of uncomfortable onto my knee, it's really give me a lot of stress. So I at home, if I do not have a roll, I take a towel, place it under the knee, and I just continue doing it. I feel my knees are very stable. So do try all this exercise and to let me know how do you feel about your practice. So if you has any questions, do write to me, and always advise for any kind of injuries or pain onto your knees or the joints to do a full class. So if you want to find me, do find me at Real Yoga's or online class as well as in the studio. Thank you for watching me and practicing with me. Namaste.